After orthodontic treatment, you need to wear a retainer. And here's a really key question that's not really asked much. What is the point of the retainer? Is it either A, to keep the teeth in the position that the orthodontist places them exactly, or, so that sounds like the right answer, or is it more to prevent a significant functional or aesthetic relapse or shift? So is it the goal of retainers to prevent any movement whatsoever, or is it to more prevent a dramatic change? And I think, as you might sort of glean by now, it's the latter. And this is why this is critically important. There are many patients who can wear the retainers pretty well, and if they lose it, they go and they get a new one. You're going to be successful if you are reasonably compliant. If you want to keep your teeth in perfect position, you must be perfect. The analogy that I give all the time is if somebody lost 100 pounds and you checked in on them 2 years later, and they really were doing a good job of maintenance, and they gained 5 pounds back and kept 95 off, that would be a complete success. I think we'd all agree. But the problem is that with orthodontic retainers, if you are imperfect, your teeth can move slightly and still look great, but then patients fall off and just don't wear it at all. Simply said, the only way your teeth can get really crooked again after treatment is if you go without the retainer completely for weeks and months and years. Then you're going to see a change. People ask me all the time about a bonded retainer, which is glued behind the teeth. In theory, the teeth don't move, but I've seen and repaired hundreds, if not thousands of them. Some I've placed, some that have come into our office for repairs. They break quite often. They're much harder for oral hygiene. When they remain in place, they work beautifully, but they are not foolproof. What is foolproof is a removable retainer as long as it's worn reasonably well.